or is it not? So how many of you have been through this question, that should we have an intimacy with the partner or should we not have? Can anyone? Yes, you can unmute yourself and answer. I would love to hear from all of you.
Yes, ma'am, I have a doubt.
Yes, yes. And how many of you really think that no, it is not a good idea to become intimate with the pregnancy around? How many of you have felt that?
Yes, ma'am, I think so.
Yes. And how many of
Initially, it
you,
was
sorry?
initially it was difficult for us to understand what is it necessary for us to be intimated, because we do have hormone fluctuating frequently. So even we do have that emotions and feeling towards our husbands when we are at home. So even I
Okay.
had the major concern about this, whether is it a very necessary, or it is very scary or like that.
Yeah. So I have been answering these questions quite a while now, and these are very normal and common questions. Okay. So let me first of all break the myth in front of all of you that it is very normal, natural, and safe to have intimate moments or intimacy with your partner during pregnancy, right? So, unless there is something which is going really wrong with the pregnancy that we will be discussing trimester wise in a while, it is not and it is nothing wrong to have intimacy with your partner. Okay, so let us start with the first trimester. So, how the first trimester goes, like the first 3 months of your pregnancy. सबसे पहले तो you miss your periods. आपका period miss होता है, then you get UP ticket, and आप आपका urine test करते हो, and then you find 2 lines over there, and you become happy. So, how many of you have been through this? All of you, right? तो एक बार जब प्रेगनेंसी का न्यूज मिल जाता है दैट इट इज पॉजिटिव एंड यू शेयर इट विथ योर पार्टनर, सो that is the most intimate moment of the entire pregnancy that you will actually feel with your husband. See, intimacy is not just on the physical level. First of all, let us understand what actually the intimacy is. Intimacy is that bonding or that feeling towards your husband, which is very unique, which is very much personal to you and your husband. So you can share intimacy with your partner at many levels. Like it could be intimacy on a spiritual level. It could be an intimacy on a social level. It could be an intimacy on a physical level, on an emotional level, on an intellectual level. So, whenever you share this happiness, these small moments with your partner, that also is called as intimacy. That is the emotional intimacy which you have with your partner. But as today we are going to talk about physical relationships and physical intimacy, whenever I am using intimacy, it will be in relation to the physical intimacy. Okay, that's clear for now for this
Yes, ma'am.
lecture. Yeah. ओके, सो जब आप प्रेगनेंसी का टेस्ट आपका पॉजिटिव आया एंड यू हैव एक्चुअली शेयर्ड इट विद योर हस्बैंड एंड your husband has become very happy about that we are going to enter into a new era of your life, that is parenthood. सो क्या होता है ना, सबसे पहले तो बहुत ज़्यादा मिक्स्ड इमोशंस रहेंगे, आप डर सकते हो, आप खुश हो सकते हो, आप कंफ्यूज्ड हो सकते हो, and then you will go to a gynecologist, you will get your test done, you will get your sonography done, and during this time when the baby is very small, आपको पता है आपका बेबी जब कंसेप्शन होता है तब वो एक नमक के दाने इतना छोटा होता है, and from there it grows to a 3.5 2 kg baby. तो जब पहले 3 महीने होते हैं ना, एट दैट टाइम आपके बॉडी को, आपके यूट्रस को भी एवरीथिंग इज न्यू फॉर द यूट्रस एंड योर बॉडी. Everything is new for the new baby who has formed, which has formed over there. Okay, so all of you are comfortable in English? Okay. Okay, so take the session in English. So the baby which is formed at the beginning, it's just as small as a salt particle, and then it grows from that small salt particle size to the baby which you will get in your hands. So at that particular time, everything is very new. The baby is very delicate. That baby will travel from your fallopian tubes into your uterus, that is the womb, and then it will get implanted. यानी वो womb में अंदर चला जाएगा, and it will get its own covers. ओके, सो जैसे जैसे वो बड़ा होता है वो द वे इट ग्रोज फ्रॉम द साइज ऑफ अ सॉल्ट पार्टिकल, then it becomes a size of a sesame seed particle, then it grows more, it becomes the size of the black pepper. At the size of the black pepper, it looks like a mulberry, a small mulberry of black pepper size. So that where the baby starts becoming visible, and then it grows into the mulberry size, and then slowly the baby starts forming its hands, its head, its legs, and the body parts. So what happens when the baby tries to go inside the uterine wall? What is most needed? Agar if you are trying to go inside, or if you are trying to invade, or if you are trying to just go into a sponge, just imagine that you are trying to go into a sponge. You as you are trying to go into a big sponge, and somebody is shaking that sponge very very poorly, very badly. Will you be able to enter that sponge?
No, ma'am.
No, right? Or even if you will enter somehow, there is a high chance that you will fall out of it. Yes, no?
Yes, ma'am.
Yes.
Yes. So same thing happens when the small baby of say around a black pepper size is trying to enter your uterus, which is like a sponge. And if somebody moves that uterus at that time, or uterus muscles starts contracting, what will happen to that small baby? Will it be able to go inside? No, it will not be able to go inside, right? And it may fall out. So intimacy, whenever there is a sexual contact, the penis, it goes into the vagina, and into the vagina, the normal mechanism during sex, what happens is the vagina contracts, and along with the vagina the uterus also starts contracting, right? So in normal physiology, whenever there is a physical contact or sexual act happening, the uterus contracts in a direction to suck in the sperms inside. But that contraction causes the very sponge like, very soft uterine muscles to contract and relax. And if this particular thing happens when a small baby is trying to enter into the uterine wall, it becomes difficult for the baby to enter into the uterine wall, and it falls down, or it cannot enter into it, and it cannot implant, and that may lead to some of the pregnancy complications like bleeding or something like that. Okay, so this can happen in the very first part of your pregnancy. So I'm not saying that intimacy is not right or not wrong, but if it is avoided in first 3 months, when the baby is very small, when the baby is developing, when the placenta around the baby is developing, it's a good idea. Okay. And even if somebody is like, no, it's like the urge is too much, and you cannot control it, or your partner is insisting at a lot of, with a lot of affection that no, we have to be intimate at this moment. What is a good idea with that? You get something called as O-nuts, which are the rings which can be worn on the penis, on the erect penis, and we can actually determine what length of penis can go inside. So, if we are preventing the entire penis to go inside using those rings, then it's a good idea even to have a sexual contact in the first trimester of your pregnancy. Okay, is that okay with all of you? Yes, are you with me?
Yes, ma'am. Yes, ma'am. Got it.
Yes. Yeah. So that is how it goes. Second, what about the intimacy if there is some complication like the placenta is on the lower side, or you have had an experience of bleeding in your first trimester? So, in these particular cases, it is better to postpone it to the time when the placenta grows up. That happens around your mid second trimester, and then you can indulge into physical activity. But still, what if your partner is not satisfied and your partner or you just want to be intimate with your partner? Then what can you do? I think there are certain techniques like you can actually use the clitoral pumps, which you get online, and you can actually teach your partner how to give you a good clitoral stimulation. And as well, you can give a good stimulation to your partner on its penis. So that can also satisfy your urge of becoming physically intimate without harming you or your pregnancy. So, whenever there are some complications going around, then these are the good techniques which will help you to navigate this particular time when you are having the urge to become intimate. So now everything is going normal. So the baby is growing. You have done your 10th week scan. You have done your dating scan, which is around 8 7 8 weeks. You got to know that the baby is growing well. The baby is fine. My placenta is good. It is in the upper part of the uterus and there are no problems, and the pregnancy grows. Then comes the time around 11 to 13 weeks when everybody is telling you, oh, you have to get your NT scan done, you have to get your scan done to see if there is any anomaly to the baby, you have to get your blood test done to find out any genetic problems if they are there with the baby. And then at around 12 weeks you go, 12 13 weeks you go and you get your NT scan done, and in that you find that everything is going normal, the baby is very good. You give your blood test, all the risk factors for genetic problems like Down syndrome are very low and they are negligible, and the pregnancy is moving ahead very normally. And this is how your pregnancy is growing. Now, as the uterus will start growing in size, as the baby will start growing in size, the contact or the physical contact will become safer and safer. And always remember, the baby is so well protected inside your uterus. The uterus is closed. The mouth of the uterus, that is the cervix, is closed with a plug. So, whatever the semen is entering into the vagina during intercourse, it is not going to go and harm the baby. But I tell you one thing, it is always good to use condoms whenever you are having a physical contact during your pregnancy. And that is why, because the semen which is getting deposited, it can have certain factors which can stimulate the uterus to contract. And we don't want the uterus to contract because there is a baby inside, there is a placenta inside, right? So, using a condom will be a very good idea to prevent the semen from entering into the reproductive tract when you are pregnant. Okay, that works. So now, whenever you are becoming, or the baby and the tummy is growing, it becomes difficult to understand from the positional point of view. So, in the normal martial positions, when the men in all, so men is on the top, it becomes little difficult because of growing baby to actually have a proper intercourse. So in these particular cases, you can change on the positions. You can take a lateral position or a doggy style position, which you can easily find out on the pictures on the internet. And those will be helpful for having a good sexual intercourse during the growing baby. Okay, so you can use these positions from like your 18 weeks up to the 30, 32, or the till the end of your pregnancy. So these will help you to give a positional support when you are pregnant, when the baby is growing. Okay, so this is one thing when the second trimester goes ahead. So now, when your baby, the 12-week scan is done, the cervix is of a normal length, and then the pregnancy is moving, and you are now the baby is grown enough and it is 20 weeks or 22 weeks, and then there is a time of anomaly scan, which is a very detailed scan, where in this scan the radiologist or the sonologist or the fetal medicine expert will check each fingerprint or each digit of your baby on sonography. And that is how they will confirm that there are no structural anomalies in that scan and the baby is growing normally. Though any of the scans you do, it will not give you 100% guarantee that the baby will be normal. But yes, the better scan and the better scanning you will do, you will get an assurity that there is a high chance that the baby will be normal and natural and good in the health and chromosomally normal. Okay. So that is when the baby and the growing baby, you will get your attention to. Just a minute. Yes. So I'm getting a lot of queries in the chat box, like I am 6 months IVF and short cervix and all those things. So we will come on those conditions once we will finish the normal variations. Okay. So don't worry about that. I'll answer all your questions. So now the baby is growing, it has become 22 weeks, and you know how to become intimate till the time the pregnancy ends and the baby is delivered. Okay. So, just one, two things which I would like to emphasize over here is that condom use is must. You must use condoms. The positioning should be good so that there is no pressure on your abdomen, and the entering of the penis into the vagina should be controlled if you are having some discomfort. So with the help of the rings which I told you, they are called ohnuts, OHNUT. You can find it on website, you can find it on any of the I think on Amazon and all, it is available. So you can just Google it and order it for you and your partner. Second, what is very good device to use in pregnancy is the clitoral pump or the vibrator, which you can use on your clitoris, so that if there are any contraindications for you to undergo sexual act, like in a lower lying placenta, or in a twin pregnancy, which is a high risk pregnancy, like in IVF pregnancies, or in pregnancies wherein there is very high blood pressure, or there are some other complications, or the pregnancy which has been conceived after a lot of previous abortions because of some reason, or if you have a short cervix where you have an encerclage done, then it is a good idea to avoid intimacy, or even if you cannot avoid intimacy, then you should be able to use onuts for controlled penetration, or you can use a good clitoral stimulator, or you can tell your partner that what feels good to you without entering into the vagina, and you should find out with your partner what feels good to him too when there is no sexual intercourse or no act of penetrative sex. Okay. So these are certain things which we need to take care when we are into our pregnancy journey. So there is nothing like nothing wrong in having an physical intimacy with your partner when you are pregnant. It is not going to give any kind of bad sanskara to your baby. It's very normal, natural. It is actually good for your emotional health, for your partner's emotional health. It is very good for you to overcome your trauma of your body shame, because then you will gain weight, you will lose your some people may lose their the skin can sag, or you can get stretch marks, or you may feel that I am now so blown up and I am like not looking so good as I used to. So all these things, they can just dissolve when you have a good physical intimacy with your partner, because then you feel you feel loved and you feel wanted. clitoral stimulation will not induce uterine contractions. They will just induce some muscle movement into the vagina, but not as such a uterine contraction. Don't worry about it. And that is very safe because you're not penetrating inside the vagina. The clitoris is an organ which is situated above your urethra, that is your urine pipe, in between the two skin folds which are over there at the top of it. So you can easily find your clitoris. So that stimulating the clitoris is not going to harm your pregnancy. But ma'am, I don't know it's superstition or coincidence. So what uh, I got I don't know. It's superstitious or coincident. Whenever I got a dream about sex, I'm getting some health complications. What should I do? No, no, no. See, it's just a dream. It's just your subconscious fear that is coming up. Nothing there. Don't worry at all. Don't be into that guilt that if you're having a sexual contact, that you will have a bad health or something like that. Nothing like that. Okay, so we have talked enough about intimacy. Now let us talked enough about intimacy during pregnancy. But I would like to emphasize one point, which is very important. That what about intimacy once your child is born? What about those first 6 months of your life with your partner when you already have the child with you? So, more than pregnancy, this particular postpartum period is a bigger challenge to intimacy. Why? Because there are a lot of hormonal changes that has occurred. There are a lot of body physic that has changed. There are a lot of changes in the body that are happening to regain your uterus and your reproductive tract to your pre-pregnancy state. So this is a time which is more challenging than the pregnancy time, and this is the time when actually anal intimacy suggested than normal intercourse during pregnancy is, see, if you're comfortable it is okay, but if you're not comfortable it is not a compulsion. And anal intercourse, regarding anal intercourse, it is always that it depends on person to person. Some people actually cannot tolerate it, some people can actually enjoy it. So it depends on your personality and perspective, if you want to go ahead with this. But I would suggest on like majority of my patients, if it is very good if you can avoid on an anal intercourse. So it's okay to have a controlled intercourse during those times. So post delivery, what happens? If you are a normal delivery, you get normal delivery, or even if you get cesarean section, you have pain somewhere in the body, in the episiotomy stitches or on the abdominal stitches. So we now during the first 45 days of the childbirth, it is that the lochia, that is the normal secretions from the reproductive tract, they are just going out. It is healing the uterus and the reproductive tract. And during this healing, if you are indulging into a sexual intercourse, then it may have some effect on the healing process. If And that too, if it is without condoms, if it is without protection, that then the tract is very susceptible to gain infections. So it is better if you can just avoid the intimacy for first 45 days, but it is absolutely normal to be normally intimate after that particular time. So what are the challenges? Like you are a new mom, you are just busy into your kid, into the baby who has born, and you are very much tired because of taking care of your baby into that particular time. And many a times the focus just shifts from your partner to the baby. So, when this happens, you understand that before the baby came, you and your partner were there for each other, right? And suddenly the baby comes, your partner actually starts feeling lonely that now she is not giving a good attention to me. Or if the partner is too much into the baby, then the partners can feel now our attention towards each other has reduced. And that may lead to reduce in the frequency of intercourse after pregnancy. Second thing, what can happen is after pregnancy, your pelvic floor, that is the space between two hip bones, that is the birth canal and all, that can get loosened up. So that can actually feel it is loosened up during the intercourse. You may not feel the sensations as you were feeling before the childbirth, or your husband or your partner may say that the vaginal canal is not as tight and as feeling good as it was before you got pregnant or during your pregnancy. So this can also happen, and this can also lead to reduction in the uh, times you are getting intimate post delivery. So, post delivery, what is very important to continue your healthy sexual life is after your delivery, you should go for pelvic floor training. You should go for good physiotherapy. You should train your pelvic floor muscles to have that contraction which was there before pregnancy. Second, now there are very new technologies like laser vaginal rejuvenations, radio frequency vaginal rejuvenations, which will help you to regain the normal tone and normal health of your vaginal canal after delivery. So wherever you are, whichever city you are, you can find out who are the people using a good device. See, there are a number of people, even dentists and cosmetologists are using certain device like lasers into the vaginal canal, which may be not appropriate to be used in the vaginal canal. So while selecting the device, while selecting a doctor for this particular treatments, you should know who is a proper person, who is a well-trained person, who is well-trained into cosmetic gynecology, who is well-trained into urogynecology, and then you should proceed ahead with the treatments. You should always check which device they are using for your vaginal rejuvenations, whether the device is a China made machine, which may not be of a very good quality, or the machine is a good FDA approved machine. And then only you should go ahead and decide whether you want to get these treatments done or not. But definitely these treatments are useful if they are done with a proper person's guidance and with good equipments. So these are certain new things which are coming up now. So next, what you can do during the postpartum period or after the childbirth during intimacy, that you may have some dryness of vagina, you may have some recurrent infections of urine, or there can be infection into vaginal canal because the system is very susceptible, the immunity is low. So once you are taking care of not contracting any infection, you can definitely go ahead with a good intimacy and a healthy sexual life. So I hope I have cleared your most of the doubts during the intimacy and intercourse during and after pregnancy. And I hope I am open to question answers now. If you want, you can just unmute and ask your questions. There is a question in a chat box regarding. Yes, thank you so much for sharing my Insta handle. Yes, please ask Manasa. Please ask your question. Ma'am, is normal pregnancy and IVF pregnancy same? No. Normal pregnancy and IVF pregnancies are basically not same. See, in normal pregnancy, the baby is getting formed inside your body, inside your fallopian tubes, right? In IVF pregnancies, we are forming the baby outside your body, outside your tummy, outside your fallopian tubes. And then we are delicately taking them and putting it into your uterus. So that is the major difference. Now, how the course of pregnancy will go, how the baby will grow, what complications can come into a normal pregnancy? Can IVF are IVF pregnancies always related with complications? No, it is not like that. After the baby goes into your uterus, the entire process of developing the baby is normal, as in the normal pregnancy. I had a minor surgery on leg yesterday due to heat boil. Uh, I'm confused about the wound dressing. Doctor suggested betadine. Yeah. Locally using betadine is absolutely safe. Don't worry about it. Clitoral stimulation, can you? No, this is already done. Okay. Is cephalic presentation position in animal scan safe to have intimacy? Absolutely. I was very deep wound, ma'am. It was a very deep wound on the leg. No, no, don't worry about it. You can use betadine. You can use a pregnancy-friendly antibiotic also. It depends on your doctor which antibiotic, but I am sure they must have given you the medicines which are safe with pregnancy. Don't worry about it. It is it normal if the baby moves only in the low? Yes, obviously, because the baby is there only in the lower abdomen at the time of 6 months. Don't worry about it. So IVF patient, yes, of course, IVF patients can be can enjoy intimacy, but normally what happens when it's an IVF pregnancy, because it has gone through a lot of medications, that it has gone through a lot of pre-pregnancy test and pre-pregnancy outcomes and pre-pregnancy treatments. So the chances of having pregnancy related complications are little more in a IVF pregnancy than in a normal pregnancy. So if you have some pregnancy related complications like hypertension or diabetes during pregnancy, or your placenta is on a lower side, or it's a multiple twin pregnancy, or if there is any other complication related to your IVF treatment, then it is better to avoid on a penetrative intercourse, but definitely you can go ahead with clitoral stimulations and other forms of physical intimacy. I'm carrying 8 months and 30 weeks. I had cervical encirclage and lowline. What is better for you is to go for clitoral stimulation. I think for you, penetrative intercourse should not be a good idea. I'm talking to Prachi right now. Yeah. Yes, Akshita. Whenever I sleep on my sides, I have to wake up many a times. I'm getting groin pain a lot. Yeah, groin pain in pregnancy is very common because, see, understand the anatomy. The uterus is attached with the bones around with some ligaments. And there is one specific ligament that is called a round ligament of uterus, which specifically goes through the groin. So whenever there is stretch on this ligament, as the pregnancy is growing, there can be a sharp or dull aching pain into your groin. So whenever this kind of pain is happening, you can just rest for some time, just lie down, just just take it easy, and the pain will be gone or reduced in some time. But there is no worries of this pain because this is very physiological. What to do for normal delivery? For normal delivery, you can do all the yoga and all those things, but see, whether your delivery will be normal or vaginal or it will be a cesarean section, nobody will be able to tell you unless the moments of your labor process. Because see, sometimes everything seems normal, your pelvis seems normal, the space of childbirth seems normal, the baby seems normal, but still there could be some problem in which you may undergo a cesarean section. So everything, the mode of delivery, you should not think before it is a labor process. You just enjoy your pregnancy, whatever will be the mode of delivery. Just believe that you are a strong mom. Cesarean section will not make you a less strong mom, or normal delivery will not make you a more stronger mom. So just be happy and enjoy the moments that are there during your pregnancy. Don't think about how I will deliver, whether it will be a normal delivery or a cesarean section. I'm 33 week and my baby position is still breech. For a breech baby position, if it is there till the end, normal delivery is very risky. The baby can get harmed during it. So going for a cesarean section is a very good idea if the baby is in breech position. After cervical, yes, there is a good chance of cervical encerclage and normal delivery, but it depends on what method for is used for the cervical encerclage. If it is a cervical encerclage using the McDonald's technique, which is a lower cervical encerclage, then definitely you can deliver vaginally. But if some doctor or some specialist has advised you for a high vaginal cerclage, which is just near your urinary bladder, that is called a Shirodkar's cerclage, then normal delivery is not possible. Then you will have to undergo a cesarean section. So it depends on what kind of cerclage it was. If it's a Shirodkar stitch, then definitely you will undergo a cesarean section because we cannot remove the Shirodkar stitch. It's over there. Yeah. Any more questions? Yes. So medical pregnancy team should be like from which month of pregnancy someone should stop intimacy. There is no need actually to stop intimacy in any month. Just first 3 months you need to be very aware about your health condition. After 3 months you can actually have your pregnancy even a day before your labor. Don't worry about it. Could you please advise after how many months it is medically safe to after childbirth? It's around 45 days postpartum because that is a period during which the uterus will come back to its normal position. So 45 days is enough time. I'm 45 years carrying. Oh, wow. So at the age of 45 years, see, you must have done all your tests, all the genetic markers, and all these tests you must have done. At the age of 45, having a 6 months and twin pregnancy, please take care of yourself. Please take maximum precautions, whatever your gynecologist over there has suggested you. Take your iron, calcium, protein powder very nicely. Take proper rest. Take proper hydration. Don't be in hurry of anything. Take proper steroids and keep on observing your baby. And if needed, they can be delivered around 34 weeks with the help of a cesarean section. So just don't worry about it. Be happy and take it easy. Yes. So, should we conclude the meeting? Anybody has any more questions? I would like to ask about the session to medical pregnancy team. May I know your name?
From me? Yeah,
Yeah.
hi, I'm Ankita.
Okay. Hi, Ankita. Thank you for that kind introduction.
It was very informative. Though we all have many queries related to how we proceed the intimacy. Is it safe? Is it not safe? Is it going to make any impact on our baby, especially na? So this is an eye opener ki how we can proceed with intimacy, and especially the portion in which you shared about the postpartum, because
Yes.
at that particular time na we women are very confused,
Yes.
though we are handling so many new things,
Yes.
breastfeeding baby, and along with that how we can manage our husband's perspective towards intimacy na. So
Yeah.
this is really uh, insight approach, and how we can focus on this before delivery, how we can talk with our husbands ki this is going to be there, and how we are going to, so be very open basically, so be very open ki this is going to be there, and we can jump on the conclusion ki how we are dealing with it. So this is very amazing. Or I believe all will agree on this ki how amazing this session, and how beautifully you had taken this session now. So we are comfortable, and we are getting all the information which we really need to have now. Okay, I believe there is one question.
Question.
Yeah.
Yeah, yeah, it's okay, no problem because the
Yeah.
system is changing. It will take some time, so no problem at all. But if it is happening too much, then just get your urine test done. If it is an infection, it can be a similar problem. So just get your urine test done. If there is no infection, don't worry about it. I feel that I wanted to be intimate, but mine not to because he feels. Yeah, so you should have asked your husband also to attend the session. That's why.
No, sometimes I have seen this went opposite also because of the hormones changing. Na, multiple women's got the feeling, the urge, na, the urge of having sex raise during
Yes, yes, yes,
pregnancy.
that
But this
is
is
very
very, I believe
mentioned
this is
here.
very normal, right?
Yes,
Because of
it's
the
very
hormones, we, ha, ha. all the magic will be just have a word with your husband, like "Ki this is very normal," and I believe after talking, everybody has their own solutions in the best way, right? And many more solutions already provided by doctor. So this is really amazing session. And we I have already shared the Instagram handle of.
Yeah, thank you so much for that. Yeah, please share, please like, follow, and share, because I'm putting in lot of information on sexual health on it.
Oh
And
wow.
I believe that there are so many handles on Instagram talking about sexual health, and many of them, they are not even doctors, they are not even trained. So I think it's my responsibility to provide a good scientific and correct information to people, so that it will be helpful for them and their partners also. So
Yeah.
please like, share, and follow, because I am studying a lot, and whatever information I'm putting, they are all research based and scientific based information. So please do that.
Yeah, that is
Yeah,
amazing.
for pregnant, for constipation, there is one question coming up multiple
Mm-hmm.
times. So you can take mild laxatives like isabgol, or you can take dufalac kind of laxatives. That is okay, but it is very important for you to maintain your diet. You have to take fresh diet which is rich in fiber, have a lot of hydration, so that will help you. And in pregnancy, having little amount of constipation is very normal, because the intestines, they slow down during pregnancy because of progesterone hormone. So
Chia
don't
seeds
worry
is
about it.
also, I believe chia seeds is also good, ma'am.
Yes, yes, yes.
For having a good fiber in their diet, na?
Yes, yes. So have, and don't strain too much on your emotions, because there is no need of straining a lot. And then it's okay even if you pass your motions twice, like once in 2 days or like that. Just don't strain. Just make sure that it is not very hard. And just these two things you should be following. Nothing else. Don't worry about it.
Oh, this is amazing. Because sometimes we are very confused what to do, what not to do if you are following man. So you already have so much information now. Whatever you are doing is right, or am I doing the right things or not? Because right now we have normal pregnancy along with that IVF also, na. So IVF mothers are more stressed towards all these things because they have conceived with after multiple examinations, injections, and everything. So that is something which is very amazing and helpful for each and every mother. Na? Ma'am, there is one more question. Na? I also wanted to know how to make husband understand it's normal having sex during pregnancy. Okay. So,
So
ma'am,
you just have to communicate well. Tell him scientifically that it is okay and normal. And if not, we can meet online next time, and you can actually take an online appointment also if you
you can make him watch ma'am's Instagram handle na, so
want.
where she has already described it's very normal, and she has shared multiple information regarding that, so you can definitely make him watch the Instagram handle of ma'am. So understood, thank you.
It's already shared in the chat box. The Insta handle is already
Yes.
shared. Don't worry.
I believe that's thank you so much. Thank
Yeah.
you all for joining. It will wonderful to have you all in the webinar. Thank you so much, ma'am, for
Thank you. Thank you
all
so
the
much.
information. Thank you once again.
Yeah.
It's a
Thank you
pleasure
so
to
much.
have you. Thank you so much.
Yeah.